You know that familiar, intense joint pain that signals a gout flare-up, often feeling like a fiery invasion in your big toe or another joint. But what if that pain comes with some unexpected guests, like fever and chills? If you experience a sudden onset of joint pain accompanied by a fever and chills, it is absolutely essential to worry and seek immediate medical attention. These additional symptoms are a serious red flag, indicating a potential infection that goes beyond a typical gout attack. While gout itself causes significant inflammation and can make a joint feel hot, red, and swollen, it generally does not cause systemic symptoms like a high fever and chills. When these symptoms appear alongside joint pain, they strongly suggest a bacterial infection within the joint, a condition known as septic arthritis. This infection needs rapid diagnosis and treatment, as it is a distinct and much more dangerous condition than a gout flare. So what should you do? If you notice these warning signs, do not wait it out. Contact your doctor immediately or head to an urgent care clinic or emergency room. Healthcare providers will likely perform a joint fluid aspiration, which involves taking a small sample of fluid from the affected joint to test for infection and uric acid crystals. This quick test can differentiate between a gout flare and a joint infection, guiding the correct treatment plan. It is important to understand that septic arthritis can occur even without an open wound or injury. Individuals with gout may be at a slightly increased risk because their joints are already inflamed and sometimes damaged, making them more susceptible to bacterial invasion. Remember, effective treatment for an infection is very different from managing a gout flare, often requiring antibiotics and sometimes even surgical intervention to drain the infected joint. Ultimately, while gout flares are incredibly painful and disruptive, the presence of fever and chills transforms the situation into a medical emergency. Acting quickly by seeking professional medical care protects your joint from severe, potentially irreversible damage and safeguards your overall health. Prioritizing this immediate action is key to a positive outcome.